Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological and intuitive care, resulting in birth and baby advice you can trust. Welcome and thank you so much for tuning in. In today's episode, we'll be talking about homeopathy for pregnancy, birth and beyond, and why it is such a great complementary remedy. Now, I couldn't find a better guest for this specific topic than Ian Wheeler, who is the founder of Pegasus Homeopathics. He is a very knowledgeable person, a pharmacist for many years, and now has got the very famous brand Pegasus Homeopathics. Hope you'll enjoy this. Hi everyone, welcome back to another episode. I'm busy with an exciting series where we're talking about all sorts of birth options, and then we've dived into some non-medical pain relief methods for labor and birth. And today's topic is another very important asset for you to have when you come to pregnancy and birth and life after birth. And that is homeopathy. Homeopathy really has a wonderful place when it comes to a natural approach to pregnancy, birth, and life after birth. And more than that, it's also a great modality because we all know we're not allowed to use medication. I think most of us are aware of it, that medication, the normal medicine which we can get in pharmacies, they can have harmful side effects on the fetus and the growing baby. And that's also where homeopathy plays a very interesting role because it's all safe to use. So I have a very exciting episode lined up for you with a guest that's on the line. His name is Ian Pegasus. We know each other for many years. He's a dear friend of mine, and also we are partnering in this mission to bring better and natural modalities to you. So hi Ian, are you there?
I am here. Hello Margreet, nice to see you again.
Likewise. Ian, I would love you to introduce yourself. So tell the audience a little bit more about yourself, your background, and what you're doing these days.
Okay, I'll scare them. Margreet, so I qualified as a pharmacist, 1981. But from my first pharmacy, I've owned 4 pharmacies over 33 years, I was always drawn intuitively to natural medicine. And I remember having a little Natura stand there. I didn't have a clue how it worked, but intuitively I was drawn towards homeopathy. When I eventually moved to Cape Town in 1990, there was a course offered. It was a great privilege. Dr. Ruth Bloch, a world-renowned homeopath who died recently in her very late 70s. Her son still runs their practice in Sea Point, and she gave doctors and pharmacists her life's work over 3 years. So I was running 2 pharmacies in Hout Bay at the time. So it was quite a commitment, but wonderful that I did it because I came away with wonderful homeopathic knowledge. I'm not registered as a homeopath. I'm still registered as a pharmacist because I was running my pharmacies, but have all the knowledge. And I realized what a wonderful healing modality it was, and decided I would practice as a homeopath. I would have had to study further, but I was going to create a clinical range of remedies, which my colleagues who knew very little about homeopathy is not still part of the pharmaceutical curriculum for my colleagues, as well as for, most importantly, the lay person out there, the mother-to-be, pregnant moms, breastfeeding moms, etc. And as the universe would have it, a week later, Dr. Anderson, who was a clinical homeopath of 40 years, she was a herbalist of 40 years, she'd worked in homeopathic clinics in the in the UK, she arrived on my doorstep. So, that's amazing synchronicity. I embraced her and we worked together for about 12 years. And with my modern knowledge, with her wonderful experience, designed the Pegasus range of remedies. So yeah, that's how and in fact, I've sold the last pharmacy just over 3 years ago. So I sold the last pharmacy just over 3 years ago. We had 11 natural practitioners working out of the health shop side of that pharmacy. We had a full herbal and homeopathic dispensary over and above the allopathic or chemical dispensary. Um, and yes, I eventually sold it because homeopathy is really the consciousness around and awareness around um, energetic modalities, but particularly homeopathy. I've even seen through this COVID time how it's exponentially accelerated. So I sold the pharmacies to focus on my passion, which is that of homeopathy, and of course, my homeopathic company, Pegasus. And I'm very pleased to be in association with you who appreciates and embraces homeopathy in this perfect arena of maternity.
This episode is brought to you by Pegasus Homeopathics. Pegasus is a trusted household name that provides safe and effective remedies for everyday ailments and little pregnancy niggles. The good news is that it's 100% safe during pregnancy and for babies. Visit www.pegasuskits.com. Thank you so much, Ian, for all of that background information. And I knew you are the person to talk about when we talk about homeopathy and complementary remedies. But not everyone out there knows you. So this is really wonderful to get the context and to get the fuller picture of the beautiful products that you've developed and your brand, Pegasus. And more specifically today, we want to focus on the maternity kit. So we're going to unpack that kit a little bit. But before we go there, can you explain to the listeners what because also as a pharmacist, you have the right knowledge. What is the big deal with normal medicine, and why must you be so careful with the use of it, not only in pregnancy, just in general?
Okay, so yeah, as a pharmacist, every drug will have a side effect. We always weigh up the beneficial effect as to the side effect profile. And so drugs can be life-saving, but they should really be used in critical and emergency situations. You know, an antibiotic is a perfect example. The antibiotics are overused tremendously, leading to a lot of drug resistance, antibiotic resistance, which is causing a lot of trouble in the world today. Homeopathy works with the body. It'll only ever do to the body that which is supposed to happen. You know, we are created very powerfully, and we are in fact capable of so much more than we even are aware of. Homeopathy is simply the catalyst to initiate the healing response. So every time you dose homeopathy, it's a message to the body. It's not a drug. It's a message to the body to initiate the appropriate healing response, which the body is capable of. Your chemical drugs are very suppressive, you know, an antidepressant, an anti-inflammatory. So a perfect example of where homeopathy chemical drugs can cause a problem. You have a baby with eczema. Normally, if a young child is born with eczema, it's genetic. It's a throwback from, it's called miasmatic theory, from generations before. So now this rash appears on a little baby. Obviously, it doesn't look great. The mother doesn't like it. The child's uncomfortable. The doctors will generally slap cortisone on it, okay? And that will make it go away, but it hasn't gone away. All you've done, you've driven that eczema deeper into the system. It will then, the illness will then manifest in another organ. Typically what happens with eczema, you drive it deeper into the body, it'll manifest in the lungs, and that child will start developing asthma. The doctors will then further give oral corticosteroids, and that then can become an autoimmune disease. And that child, as an adult, will have ongoing problems forever. Homeopathy will go deep, and it does what we call constitutional healing. So that kind of work would need the work of a classical homeopath. I'm trained that way, but because I don't practice that way, I refer my patients for deeper chronic work to a classical homeopath, where they will find the constitutional remedy of that patient, and that lifts their whole vital force. Drugs work on drug pathways, on neurotransmitters. neurotransmitters. Very different. Homeopathy is far more ethereal. It works on the higher mind, on the subconscious mind, just purely sending messages. There is no overdosing. It's a wonderful healing modality. So yeah, you want to take drugs for as short a time as possible and as infrequently as possible.
Yeah, that great. I want to make mention of it right here now. We've done a beautiful course with Ian last year that is on our website, where he goes way more into depth on how homeopathy works. So we will send a link. We'll put a link out there, but get your hands on that course. It's for free. If you want to understand more the how homeopathy works. This session is too short for that, and I want to get to the how we can use his products and the Pegasus Maternity Kit during pregnancy and birth and labor. So Ian, we would love actually women to have a homeopathic birth, right? Not only to have it as when they have a problem, but just to have their whole pregnancy and birth supported with homeopathy. And how is that possible, and how does the maternity kit support that?
Okay, so the other advantage of homeopathy, you don't need to diagnose. You simply match the correct remedy to the presenting symptoms. So there is a bit of a stigma out there amongst a lot of women that the pregnancy and the birth has to be medicalized, that there has to be allopathic intervention. And, I think we've got to remember, with respect, maybe easier for a man to say than a woman, but women are designed to give birth and have babies, okay? So we don't want to lose sight of that. So homeopathy is absolutely perfect, because take the Pegasus Maternity Kit. We work with high potency, so there are no side effects. There isn't any measurable molecular mass in the remedies to cause an anaphylaxis or a side effect per se. As I said, homeopathy will only do to the body that which the body automatically would do, but optimally so. So it's a wonderful healing modality. And we want to promote natural birth, Margaret. As I said, that's what women are designed to do, because you expand on that in all your wonderful information through your Sister Lillian Center, is that by having the natural birth, it's so beneficial to both mom and baby. The world is quite tough. Living in the world is not actually straightforward. And a natural birth, struggling a little to get into this world, prepares the patient psychologically, even though little babies don't know it yet. But I believe it prepares for being a little tough and coping with the world. For the mother, it produces a lot of hormonal release, helps her to bond with the child really well. It's also, I believe women who have natural birth don't succumb to psychological issues and depression afterwards as much as women who might just have a Caesar. Those are just my thoughts, But so homeopathy empowers women because it's safe to use. They don't have to run to a doctor or an obstetrician for every single little thing. So the maternity kit pretty much starts from the beginning of in all stages of labor, of preparation of the body for the birth. So the whole idea, as I write here, is the kit consists of 8 homeopathic remedies and a topical oil to facilitate a healthy pregnancy term, ease the labor process, and enhance recovery, thereby reducing the risk of complication occurring in both natural and C-section should that happen. So for me, the C-section should only occur where there are complications or an emergency. Natural birth is the way to go. So this little kit is intended for every single woman who intends to have a natural birth. Should she end up having a Caesar, the remedies are still very applicable, and the kit doesn't expire. It can be used for a second and even a third birth. So, yeah, shall I run through the remedies, Margriet?
Yes, go for it. That would be very helpful.
Okay. Okay, so the first remedy is also available in the blue box kit, my full-on homeopathic emergency kit. It's called the VMT, Vertigo, Morning and Travel Sickness. And this is a perfect example where you want to avoid drugs. Remember in the early 60s, late 50s, the thalidomide babies. Thalidomide was a chemical drug intended for nausea in pregnancy, a morning sickness. And that caused a heck of a lot of problem. I don't know, tens of thousands of babies were born without limbs, for example. So why take that chance? So the VMT, very, very safe. It's used in the initial stage or early stages of pregnancy for pregnancy nausea, vertigo, travel sickness, but mainly in this case for the morning sickness. The second step, the second remedy would be the pregnancy remedy. It starts to be taken from initially from the 30th week of pregnancy through to the 38th week, and it a birth as possible. Do you want to know some of the key remedies within that remedy and what they do, Margaret?
Yes, go for it, Ian. It's interesting.
Okay, so for example, the pregnancy remedy, there's colophyllum in there, which is blue cohosh, okay? So what it does, it tones the muscles of the cervix and the womb. It enables the os to dilate easily. It's useful when there are false labor pains, which can be annoying. It further progresses the labor. It helps gauge even a breech baby. The second remedy is gelsemium. It's an excellent anticipatory remedy. So anticipatory anxiety remedy. Excellent where there are emotional reasons, performance anxiety, fear of letting go, being observed or watched, cramps in the abdomen and legs during pregnancy, and false labor pains. And finally, pulsatilla. The keynote of pulsatility is changeability. So the patient can be very emotional, weepy, and mildly irritable. They often want sympathy. They may complain that the baby movements are painful. The patients may feel hot and want fresh air. It will aid also in turning a breech baby and where there are weak contractions with little cervical dilation. So not every patient or any patient will have all of those symptoms, but if any of those occur within the pregnant woman, her body will take out of that remedy that which is meaningful to her. So it covers all of those aspects. The next remedy is the birthing
Ian,
remedy itself.
Ian, just to
Hello?
clarify, is that the pregnancy
Yeah,
remedy, right? That's the pregnancy remedy that you just referred to.
correct. So after the VMT, that would start from the 30th week in the pregnancy in preparation for the labor.
Okay, that's great. And it's
Okay?
nice to know that it covers all those different elements. So whatever the woman needs. And
Yeah,
some women might have some sort of anxiety that she battles
yeah,
with to get her into a calm space. And others might just be a physical stuff to get irregular contractions more regular. So it's a nice combination
exactly.
remedy. It's beautiful.
Yeah. And as I said, Margaret, you never want to put a bunch of chemicals together. Polypharmacy is a dangerous thing. But with homeopathy, we combine these remedies very carefully because even they can antidote one another. So these are very carefully researched. And the mom to be might say, but I only have one of those symptoms. It doesn't matter. Her body will extract that remedy that is pertinent to her, but it covers all the aspects should anything else evolve. So then the third remedy is called the birthing remedy. It is taken in the last 2 weeks. So from the 38th week onwards, it would be taken into labor and the dosing with homeopathy is also very applicable or just adaptable. You would take it 3 times a day in the last 2 weeks of pregnancy. During the labor, if labor stalls a little bit, is battling, it can be taken every 10 minutes to kickstart the labor. But it's all very nicely outlaid. We put a little flyer within the maternity booklet. This is what it looks like, by the way. That's our little maternity kit. The remedies are in there. It comes with a booklet which comprehensively explains everything. And we have further introduced a little flyer that goes onto the fridge, giving you the sequential application and use of the various remedies. So then the fourth remedy, once you had the baby, of course, is the postnatal remedy. So this is for healing post-birth, for any trauma that may have occurred during the birth. It's got things, let's just run through that one, for example. The birthing remedy, the postnatal remedy. So that has got Apis mellifica in it. Apis is the bee venom. So severe ovarian and uterine pains, of a stinging nature, with great tenderness over the abdomen, uterine hemorrhage. It gives great comfort post-birth, and it helps avoid sepsis. The other remedy is Arnica. You all know Arnica montana. It is for bleeding tissue trauma. The abdomen and uterus may be bruised. If there's a hematoma, that is like not a blood clot, but a traumatized area that holds blood and is swollen. A bruised soreness of muscles and tissue where overstrained, and shock. It deals with shock as well. The Bellus perennis is excellent for injury to deep tissue, especially post-surgical work. Muscles are sore and there's nerve injury. So you're cutting a very nerve-rich area. Cervical lacerations, periurethral or bill tears, pain radiating down the legs, suspected uterine rupture, especially with VBAC post-surgical forceps birth. There's calendula, where there's exhaustion. Hypericum is the arnica of the nerves. You're cutting a nerve-rich area. And rus tox is very helpful where fibrous tissue is affected, ligaments, joints, and tendons. And, giving birth is a lot of that action going on. And so forth. So they're all very nicely laid out to explain the application of. Obviously, some mothers may have had an emotional birth or a past trauma with past births, for example. And there we've got the postnatal blues remedy. We want to avoid chemicalization. So we would want to avoid, if possible, women going on to chemical antidepressants. If it's critical, there again, homeopathy is complementary. So if the woman has to go on to an antidepressant, let's try and do it for as short a time as possible. But the best thing is prevention, if we can avoid that. So firstly, I would go to the postnatal blues remedy, and it deals with emotional trauma, postnatal depression, anticipatory anxiety, fear, weepiness, etc. Great remedy. The next remedy would be the Hemotonic Remedy. Brilliant if there's been a difficult birth, loss of blood, for example, and the patient is just exhausted. It might have been a long endurance type of birth. That remedy works on many organ systems. It obviously puts natural iron back into the system. It also helps assimilation of iron into the system from food or elemental iron that the patient may be taking. So, I've had a woman so anemic, they're on intravenous iron and the hematocrit hardly moves. Give them the homeopathic remedy in conjunction and the hematocrit accelerates beautifully. But it just lifts a low vital force, so it's wonderful for recovery. We do a lactation remedy, which just aids the woman in lactation. If she's battling with the milk, the quantity and or the quality of the milk, it just helps that to be as optimal as possible. And then we do a mastitis remedy as well. So should that occur, inflammation of the breasts, often when the mother wants to wean off and mastitis occurs, that remedy deals with all the natural anti-inflammatories, cracking of nipples. It covers all of those aspects. And then finally, there's something called the renewal oil. And the renewal oil is a high quality tissue oil with various infused herbs that are healing, soothing. It's good for stretch marks. You can apply it pre and post birth to the perineum. It'll help the perineum not to split. That's not the right word. What is the word I'm looking for? Tear. Thank you. Oh my gosh. Thanks, Margaret. So and it's great for stretch marks. Dr. Anderson used to use that very oil on her skin. She had skin like porcelain. It was quite amazing in her late 70s.
Thank you so much for that, Ian. It's a wonderful kit that you've put together and so user-friendly. You did say that you can use those remedies in case, if you've had lots of bleeding, you can do the hematonic one and the lactation one. But just also to stress that you can use those remedies even if you don't have those conditions. You can because it will support and prevent things from happening. So that kit is really useful right through pregnancy, birth, and life after birth to just support your body going through all of this and support it with doing what it does best. Am I right in saying that, Ian?
Yeah, I think that's an important point. The kit is not just for when there are problems or complications. It's every pregnant woman intending a natural birth should have the kit because it's going to enhance the body to work as optimally and efficiently as possible and, dilate properly, contract properly. Everything that's supposed to happen will just be messages are sent to work optimally. So it's there to avoid complications, actually. It's almost like a little security blanket to avoid complications. But should, for example, something extreme happen and the patient needs allopathic intervention, it doesn't interfere whatsoever because homeopathy resonates at a much higher level. Our drugs are quite base, hence you will have side effects, etc.
Great. So that is definitely a have to have if you want to have a natural birth. And I'm sure everyone listening to us here are in for that because we are all about natural birth here. So also really great ideas to have it as a gift on a baby shower, gift your pregnant friend or your sister with this kit. It will really, it's a wonderful, wonderful asset to have. Ian, where can we find these kits if we want to buy them?
Alrighty. Well, I mean, through you, we have a close association with your online shop because you guys can give that advice and that on the product as well. But aside from the Sister Lillian Center directly, you can buy online. Any discount should have them. Most wellness warehouses will carry the maternity kit. And quite exciting, at Dischem have bought Baby City. And they're very interested in our kits to keep them because that's where people go when they intend to be pregnant, are pregnant, or people wanting to buy gifts for baby showers. And so we're hoping that happens as well. But right now, I would go straight to Sister Lillian online or to your local Dischem or health shop or wellness warehouse. They retail at about 599 Rand. The remedies don't expire, as I said. Once we launch them into Baby City, we'll have the individual remedies available as well. So if you had your first birth and one remedy runs out compared to another one, you will be able to buy the refills as well.
That would be great. So yes, Ian is right. You can buy it on our website, sisterlilliancenter.co.za, in our shop. And else, if you're not an online shopper, you can find them in many stores countrywide. If your local Discount or Baby City is not stocking them, ask them to get it. That would be my advice. And yeah, so I think this was a really helpful, resourceful session. Ian, thank you so much for always being so how can I say, generous with sharing all your knowledge, because knowledge gives power, and I love that about you. You help us to understand and therefore empower us. Because I've learned all about homeopathy through you, so thank you for that.
Well, yeah. Thanks for embracing Pegasus. Homeopathy, natural medicine, as I said, my passion, but particularly homeopathy. And, something I always quote to the layperson, if they're not quite sure of homeopathy. I've had my pharmacies 33 years. My boys are 31 and 28. They've each ever had one antibiotic in their lives. They're in the blue box kit, which is great to have post birth for your whole family. They've used the antiviral antiviral, antibacterial, the natural antibiotic. No sodes of penicillin, streptomycin, but without affecting the microbiome, your friendly bacteria, works with the body to build an immune system. So, the fact they've each ever had one antibiotic in their lives, and on both occasions were away from me, endorses homeopathy.
Yeah, if you can use it on your own kids, then you really believe in it. Ian, I think
Yeah,
we need to do another session on the blue box and all sort of applications for family life. The blue box is fantastic.
wonderful,
But yeah, for
wonderful.
today, we really covered everything for the maternity kit and how to use it right through pregnancy, birth, and postnatal phase. So that was us for
Okay.
today. I hope you enjoy that. And yeah, check out the maternity kit online. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.